Health Minister Dr. Zweli Mkhize will today visit the Nqadu Great Place at Willowvale in the Eastern Cape to meet with acting King Dumehleli Mapasa and traditional leaders around the issue of circumcision and funerals against the backdrop of COVID-19. The holding of the funerals and cultural ceremonies has been a challenge for law enforcement officials who are struggling to ensure compliance, especially in rural areas. This has resulted in a number of arrests. The province has already cancelled circumcision rituals, but illegal ones are still being conducted. We cross now to our colleague Atule Joka. Atule, a very good morning to you. Where exactly are you?
Well, good morning to you, Desra, in studio. We are at Nqadu Great Place, just outside the homestead of King Dumehleli Mapasa, who had just departed last year. We were here in November when he was sent off in a royal send-off in a military state official of funeral category 1 funeral, which also had military elements. This is the homestead of the King of Amaxhosa here in the Eastern Cape. We are expecting the Minister of Health, Dr. Zweli Mkhize, to be here in an hour or so to come and deliberate over these issues. We understand that Chief Dumehleli Mapasa, of the right hand of the Amaxhosa kingdom, will be here to deliberate over those issues, amongst also a number of traditional leaders. We do know that Chief Dumehleli Mapasa was elected as an overseer. They did say that he's not acting in regency. He's not the acting king, but he's an overseer here in this kingdom of Amaxhosa. So he will be here to deliberate with Dr. Zweli Mkhize over these issues. We know that circumcision has been quite a problem in a number of years. A number of initiates have died. Hordes and hordes of young initiates have died through the rite of passage at the mountains. So with this global pandemic, which is coronavirus, it is quite important that the kings, together with governors, they are very delicate in this matter. They sit down and discuss over these issues. And also the March and April circumcision period was suspended, but the June one, the winter season, we were still awaiting an official comment from the traditional leaders, from the House of Traditional Leaders as well, and also the Cocta department. They were saying by the latest on Thursday, they will make that official announcement. But from the sense of what we were getting from the discussions that we had with them, they said they want to prioritize lives first, because we know that there's an issue of hygiene which takes place as well, that takes place during those proceedings. So they were saying, of course, it might seem that during winter season it will also be suspended, but it will pose a challenge as well going forward, because in June and December the school calendar year will be affected as well.
Have we seen the agenda for the meeting today in terms of all the conversations that will get underway?
This is a meeting which was quite abrupt and also very urgent, because the homestead, the kingdom, also sent us a message last night that they were told that the minister is also coming here. So it's a message that was very abrupt, but we do understand that they will discuss over those issues, because we know that most of the initiates come from school and go to the initiation school. So if the calendar year for June will be affected, and also in December the school calendar year will be affected, so it might happen that this whole year initiation might not take place. So I'm sure they want to deliberate over those issues as to what will happen, and also the issue of funerals. We know that most of the cases of this novel coronavirus here in the Eastern Cape were attributed to funerals where people did not abide, did not maintain hygiene levels. So they want to come and discuss with traditional leaders, because they are also fighting a losing battle in trying to make people understand that yes, you love your people. Yes, it's customary to try and support your loved ones. But this particular time, we urge you to please stay at home, because this is how this virus is contracted.
Thank you so much for that report. Thanks, Atule.